Low testosterone. Very common, hot topic. If you're interested about this, watch this video and leave a comment down below. Welcome to Talking with Docs. I'm Dr. Brad Winning.
I'm Dr. Paul Zalzal.
And I'm Dr. Richard Casey.
Dr. Casey is a urologist and has a specific interest in male and female, for that matter, urological issues. Today we're talking about low testosterone. So Dr. Casey, what does it mean when someone has low testosterone? What are these people showing up with?
Well, most people who have low testosterone have absolutely no symptoms at all.
Okay.
Thanks for watching.
So, I mean, it happens to us as we get older. Our testosterone levels tend to drift downwards. There's a small percentage of men who have testosterone that's low enough that they develop symptoms, and these symptoms are fatigue, difficulty concentrating, muscle weakness. They get a little bit, gain a little bit of weight. Their libido may be a bit less, very similar to the symptoms of just aging.
Okay, so just about every one of our viewers is experiencing that right now.
Yeah.
It doesn't mean you have low testosterone, but we're going to dive into this a little more.
No, I mean, you have to make sure that you measure testosterone appropriately before you make the diagnosis that their symptoms are due to a low testosterone.
Right, because those are some pretty vague symptoms that a lot of things could be attributed to that.
Yeah, I mean, there's so many things that we do in our life that could do the same thing. So the way we diagnose low testosterone, other than a history, there's very few physical findings. Most older men are not muscular, so we don't look for muscle mass, and most men are heavy.
You see Brad without his shirt on?
No, I don't want to this early in the morning either. Okay.
What about like an exam of your gonads, of your testicles?
I mean, that doesn't really help us that much.
Right.
Certainly if the testicles are quite small, it would support a diagnosis of hypogonadism, but
It's uncommon. Right?
it's rare that we find any physical findings. So essentially measuring serum testosterone in the morning, because our testosterone levels are the highest in the morning and can vary from being well within normal range in the morning to well out of normal range in the afternoon. So a random testosterone doesn't tell you much. You have to get it done in the morning, preferably before 10 o'clock. And we like to see two to confirm that you actually have a low testosterone.
So two tests separated by a period of time?
About a week, yeah.
And when we talk about testing for testosterone, so the majority of our testosterone is bound, right? And then this very small percentage is free. So do we care about the free and the bound, or?
When andropause was first introduced as a potential disease, for lack of a better term, a lot of clinicians looked at ways to differentiate real low testosterone from patients that just had variability. So free testosterone or bioavailable testosterone was developed. These they vary less, but really we want something that varies with the clinical symptoms, and the best marker has been found over the last 10 or 15 years. Just do total testosterone.
Okay.
So most men would not treat someone with a normal total testosterone and a low free testosterone.
Okay.
So andropause, that term andropause. Just want to jump on that.
Andropause was a way to medicalize aging a little bit. I mean, most men go through changes as we age. Some men go through quicker. Their testosterone levels will drop quicker for lots of different reasons. But it hasn't been a term that's stuck that much, so most of us in the business don't use that terminology any longer.
Okay, fair enough. So you've had these symptoms, which are vague and can be attributed to a lot of different things, but you did get your testosterone. You went to see your doctor, and you started the workup. You're getting serial blood tests in the morning to check your testosterone level, and lo and behold, it's low.
No, you have low testosterone. Let me back up a bit.
Okay.
I mean, there are some groups that your physician should probably screen that are likely to have low testosterone.
Okay.
Diabetic men, certainly heavy diabetic men, men with chronic pain, obviously men that have had chemotherapy, and any kind of stressful illness will often impact you, so you have a low testosterone. But back to you, after that's been confirmed, then the discussion has to be, what do we do about the low testosterone?
Right.
Okay.
So we always like to talk on our channel, is there anything we do other than going straight to a specific either supplement or medical treatment? Is there a lifestyle modification that people can do to combat low testosterone?
So the patient who is overweight, again, who's drinking heavily, maybe taking too many pain medications, the lifestyle is very important to help with the symptoms. It may not change your testosterone levels, but all we're trying to do is treat the symptoms anyway.
Sure.
So all my patients get the same discussion. You're 50 pounds overweight. You should consider losing weight. You got to stop smoking. Don't drink so much. And those are important factors. Exercise is always the case.
And healthy diet.
And healthy diet.
Okay. So you've done all that.
After the testosterone remains low,
Would you retest? Would you give them, say, 3 months or 6 months, or how does it work? Like, would you...
I mean, I'm not going to give them 3 months to change their lifestyle, because you and I know that very few men change their lifestyle. But I sort of, what I tell them is I will consider treating you for your low testosterone, but you're not going to get the benefit unless you do some other things.
Okay.
Taking it and standing still and not changing your life is going to have a very little impact on the way you feel.
Okay. So now we're talking about a lifestyle and some sort of
So testosterone is what we use, and because testosterone is such a big molecule, taking it orally doesn't work. It gets destroyed in the stomach and doesn't get digested. So topical therapies or injectables are the two major. Topicals are probably the more popular because you don't have to give an injection.
Okay. And so what are the direct benefits of testosterone? Like, what does testosterone do in our body that makes us feel better?
Well, I mean, those androgen-sensitive parts of our body, our muscles, our skin, some of our organs, our brain, all respond to low testosterone by reducing their metabolic rates and deteriorating, and respond when you give them testosterone. So the first, what we hear from patients first is that their energy levels are better and they feel a bit better sexually, but not that much different, and they have more energy, and if they exercise, they respond to it. So I tell everybody, if you want to really see the effect of your testosterone, drop weight and do some exercise, and you'll see a real impact.
Okay.
Okay, and now we always ask this about any intervention. What are the risks? What are the side effects of going on this kind of a pharmacotherapy for low testosterone?
I mean, testosterone is a good therapy for those guys who need it. It's fairly useless for men who have normal testosterone levels. It doesn't do much, except for give you greasy skin. But the major side effect is it affects your hemoglobin, because it does drive in males, our red blood cells are produced with the urging of testosterone. It's a big part of what keeps our hemoglobin up. So we have to check their hemoglobin, and we have to check their prostate. So patients starting on testosterone should have a DRE, a rectal exam, should have a PSA, and their hemoglobin assessed, and then assess the hemoglobin. We assess quarterly for the first year, every 3 months. And PSA we will assess yearly, because if we are using it for replacement, there's no danger in causing cancer, because all we're doing is putting back testosterone that our body needs. But men do tend to think that if a little bit is good, a little more is better, particularly with testosterone. Yes. So we want to check their hemoglobin, so the hemoglobin doesn't get too high, or hematocrit doesn't get too high.
And the reason that's a problem is because it can lead to heart attacks and strokes.
Yeah, sludging the thick blood. And that's what we see it more with the injectables than the topical therapies. Okay. But we measure it, and we also can. Not all men will absorb testosterone through their skin, so we want to make sure there's an effect.
And this is also why it's a banned substance in many professional sports as well as collegiate sports, because it increases your blood count, which increases aerobic performance, as well as increases your muscle mass and subsequent performance.
Yeah. I think most men feel better because their hemoglobin's higher. That's right.
Wow, that's the skinny on testosterone, right?
Yeah.
Okay. Hopefully that has helped you if you had any questions but didn't feel like asking your doctor about it. Yeah, hopefully this video encourages you to ask your doctor about it if you're worried that you are suffering from low testosterone.
But the take-home message is that most of us aren't. A lot of it is just part of normal aging. And if you can live a healthy lifestyle, exercise regularly, and get rid of things like smoking and drinking, these also have the same benefits.
It's a lot of patches, eh?
A lot of patches.
You got the nicotine patch to quit smoking, you got the pain patch because you're in chronic pain, you got to throw on a testosterone patch
over your mouth to keep your mouth shut too, or you get older too.
You got to get a new nickname, Patch.
There you go. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
And thanks to Dr. Casey for coming and joining us again.
My pleasure.
Thank you so much.
Thank you.
We'll see you next time.